Hello, our lecture today is about measuring the glomerular filtration rate. We can measure the glomerular filtration rate or the G.F.R by depending upon the renal clearance of substance. We have two ways to measure the G.F.R. The first way or method is the direct way, which is called the micropuncture technique, and the second way, which depends largely upon the renal clearance of a substance. So what is the renal clearance of a substance? Renal clearance, it is a volume of the plasma which is cleared from a substance in a period of time. For example, in 1 minute. So in this term, usually a substance is injected into a patient or into an experiment which is done upon a person, and then the concentration of this substance, of the injected substance, is measured in the plasma and in the urine of that patient, and then specific formula is applied to calculate the G.F.R. First of all, the substance which has to be injected or which has to be used to measure the G.F.R must has specific features. First of all, this substance must be non-toxic and must be not reabsorbed from the renal tubules, must be not excreted or secreted by renal tubules, must be not metabolized, and must be filtered freely from the glomerular filtrate or glomerular filtrating membranes. For example, we have the substance para-aminohipurate. This substance, para-aminohipurate, is secreted by renal tubules, and for this reason, the glomerular filtration rate or the renal clearance for PAH, renal clearance for this substance is greater than the G.F.R. Why? Because PAH or para-aminohipurate is secreted by renal tubules, so the renal clearance of this substance is greater than the glomerular filtration rate. Another example is the urea. The renal clearance of urea is less than the G.F.R. Why is that? Because urea is reabsorbed by renal tubules. So we need a substance which is not excreted and not reabsorbed by renal tubules. Why is that? Because we want this substance to equal to the G.F.R. in order to be exploited for measuring G.F.R. So some substances can be used, such as, for example, inulin. Inulin is about a polymer of fructose. Mannitol, and also vitamin B12 labeled with radioactive cobalt. So for example, the inulin is not reabsorbed after being filtered, of course. After being filtered, inulin is not reabsorbed by renal tubules, not excreted, so the renal clearance of inulin is equal to the G.F.R. And here we can measure the G.F.R. by using inulin. There is an equation to calculate the G.F.R. which is the same for renal clearance. So renal clearance of a substance equals to concentration of this substance in urine multiplied by volume flow rate divided by concentration of the substance in plasma, and we have chosen the inulin, which the renal clearance of inulin equals to G.F.R. So G.F.R can be measured by the use of inulin and exploiting the same equation, the urine concentration of inulin multiplied by volume of flow rate divided by plasma inulin. So first of all, inulin is injected, and after a period of time, which is 1 minute, the concentration of inulin is measured within the urine and within plasma, and then by applying this equation, G.F.R can be determined. So in normal person, let's replace these by normal values of normal person. G.F.R equals to, in normal person, in 1 minute, the concentration of inulin is about 29 multiplied by 1.1, the volume rate flow, divided by concentration of inulin in plasma, which is about 0.25. And here the G.F.R will be equal to 128 ml per minute. So, if there is any defect, in filtration process of inulin, or inulin for any reason, any defect in renal system, reabsorbed or excreted, so of course the G.F.R will be not normal, or it will be not equal to 128 ml per minute. For example, if concentration of inulin in urine is greater than this value or lesser than this value, that means inulin is either excreted by renal tubules or reabsorbed for a defect in renal system. And here we'll explain for us the abnormal G.F.R. That's all for measuring the G.F.R. And let's speak about another important thing. We have two terms, the tubular maximum transport and the renal threshold. Tubular maximum rate means if a substance is filtered, there will be specific or a limit of concentration to which the renal tubules can reabsorb that substance. For example, the tubular maximum for glucose, for example, equals to about 375 milligram, which can be reabsorbed by renal tubules. If the filtered glucose exceeded this value, so renal tubules cannot reabsorb more glucose. This is what we mean about tubular maximum transport rate. And what's about the renal threshold? Renal threshold means the concentration of substance in a plasma at which the first appearance of the substance will occur in urine. For example, for glucose, concentration of 180 milligram per 100 ml of blood. If the glucose level reaches this level in the blood, so glucose after that will appear in urine, and this is the renal threshold. In other words, if the glucose level exceeds this ratio or this level concentration in the plasma, it will appear in urine, and this is what is called the renal threshold. Thank you so much for listening.